Hey guys, today we are going to talk about public health and what it means for us, um, which is quite interesting actually. When we're looking at some of this stuff, this PowerPoint, as you can see, was made in 2013, but it's never been more um, something that applies to the current times than right now. Um, This was a topic that I didn't even really intend on covering this year. Obviously, we were going to be out at the sites, but with our extra time in more of a classroom type thing rather than getting our clinical experience, public health um, kind of appealed to me when I was looking through some online ideas because of everything being so real life for us right now. Public health is something I can't tell you the number of times um, in the last few weeks while working at the hospital that I've mentioned to someone how surreal it is that my whole life, my whole career, um, from starting when I was a seventh, eighth grader in health class. They talked about epidemics and pandemics and the steps that would need to be taken if that were to become a reality. And it was one of those things that you never thought you would actually have to use. You hoped that you never have to use it, and what do you know? Here we are, um, smack dab in the middle of it. So it's kind of interesting. Hopefully, you guys will think it's interesting as well. I like this quote, and I have to be honest with you. This PowerPoint came straight off of CT Online. It's a site that I've joined while we've been in the distance learning, but I just love this quote. Um, it is logical to expect that there is strength in numbers and that partnerships can mobilize material and human resources and be more effective at achieving desired goals than individuals working alone. Kind of an old quote, 2002. Um, some of you may or may not have been alive when that quote was written, but um, I like that. I like it a lot that strength in numbers, okay, can help us to be more effective at achieving goals. I think of all of you guys, and you guys are all on teams, things that you have known your whole life, but I've also seen it happening right now at the hospital. Okay. I can't tell you the number of times that um, different people, Carol, as my kids lovingly call her, concession stand Carol. Um, just last week, she brought in a huge bag of homemade masks for us to be able to hand out to patients. Um, Royal Oak, Walmart, um, Ida's, however you want to call it. They've all brought in food, donated food to the workers. Okay. Walmart workers they saw a shipment of masks come into the hospital and they knew the hospital was short on, or into Walmart, sorry. They knew the hospital was getting short on masks. So rather than the pharmacy workers putting them on the shelf to sell, they bought them themselves and purchased them and brought them out to the hospital for us to use as a donation. Okay. So, strength in numbers has never been uh, more true in our community than it is right now. Doesn't feel like it at times, but we are getting through this because of each other. Okay. Um, Working together, working in numbers gives us more materials, gives us more masks, more PPE, and of course more people to work together. Okay. Athletic training, I never ever thought that I would be taking temperatures and asking questions about um, having a fever or chills in the last 24 hours. Never thought I would be asking people if they have had a cough, shortness of breath, difficulty breathing. Never did I imagine that I would spend my entire day asking that question every time someone walks in the building. Okay. But if I'm out there doing that, then the nurses can be in the back in the ER taking care of people, and I can have them mask so when they get back to the ER staff is more protected. Okay, so working in numbers helps us with human resources, but with material resources as well. Some objectives. Okay, we're going to talk about roles and responsibilities of public health, some core functions, some services of public health, and then look at a little bit of the roles of each level: federal, state, and local. Okay, when we're looking at health, health is a um, dynamic state um, of complete physical, mental, spiritual, social well-being. Okay, it's not just staying healthy or just the absence of disease, but um, a well-being. Okay, there's a big difference between um, just not being sick and feeling well. Okay, being well. We can be not not ill, not full of disease, but not have mental well-being or spiritual well-being or social well-being. Right now, social well-being is huge, okay? Um, and a lot of times I worry that you guys are looking at my little word of the day and thinking, "Oh my gosh, here she goes again on her little soapbox and with her little quotes and whatever." Um, but my number one goal of this time is to know that you have physical, mental, spiritual, and social well-being. I can't physically be there with you to provide that social well-being and to check on you, so I'm trying to find different ways to observe it as best I can. Okay, because like I said, that's my number one goal is your overall health. Not just the fact that you're disease free, you're COVID free, but you are mentally, socially well. Okay. Um, I like, especially now in today's times with everything that's going on, that dynamic state. Okay. I have never ever been involved in something that has been so uh, dynamic, so something that has been so changing. Okay. We joke at the hospital nearly daily, and it's slowed down a little bit now that we've kind of gotten into a groove over the last few weeks. But there for a while, I was getting easily 15 to 20 emails from the hospital a day with different policy changes, different updates, updates on PPE, use of PPE, sterilizing PPE. Um, it was constant changing, and literally, it could be hour to hour. If one of us was on shift for our 6 hour shift, we might have 4 or 5 people come by in that time and change our policy, change our procedure. Okay. So it's extremely dynamic. Then, when we're looking at public health, and a lot of you guys had excellent answers when we were talking about public health, but it is what we collectively do as a group to assure that conditions are right for people to stay healthy. Okay. So if we're looking at that, um, not even just current times, but public health often sends out in the summertime um, warnings, information, education about heat. Okay. Um, if it gets warm and nasty and humid, and people aren't aware of the dangers and they're outside working in the heat, um, they're not going to be able to stay healthy. Okay, we're not going to be able to keep the community healthy. So that's another way that public health can address something like that. Of course, there's lots and lots of times that public health right now is um, working to assure that conditions are good to keep people healthy, whether it's making us stay home, closing our schools, Now recommending that anybody wear a mask when they go out in public. Okay. All those things are trying to keep the conditions to where people can stay healthy. Okay. The vision for this, for public health in America, is just simply to keep people healthy and keep communities healthy. If people are healthy, then communities are going to be healthy. They do that by promoting physical and mental health, preventing disease, injury, disability. Okay. Some generic goals, um, preventing epidemics, spread of disease. Okay, that's pretty simple. Protecting environmental hazards. That's what protects us against environmental hazards. That's what I was talking about with the heat stuff, okay? With the heat, with the cold. Um, Not necessarily from public health, but public health works with the sheriff's department. And most winters we receive phone calls with messages about the weather conditions, whether it's getting excessively cold, whether we're getting a big snowstorm or an ice storm predicted. But definitely they work together with environmental hazards. Preventing injuries, whether it's OSHA working with workplace injuries or just taking safety concerns, making changes around the community with road conditions and high traffic areas. Promote and encourage healthy behaviors. Um, of course, public health talks about um, eating right and the nutrition pyramid, being active, puts out commercials with about smoking and being active. I think this is a big one right now that's been weird for me to see, but all of the commercials, you can't hardly turn on the TV without seeing a commercial or a little ad or some characters from your favorite show talking about COVID and how it's affecting them and steps that they're taking to maintain health. Respond to disasters and assist communities in recovery. And we are in a public disaster now, and public health is working hard to respond to that by creating more ventilators, rounding up PPE, um, anything like that to help in this um, crisis mode. Okay, assures quality and accessibility of health services. Um, Not in crisis right now, they're not, but um, any of you that have family in healthcare can talk to you about um, when the state's in, and it's always the state's in, um, as in kind of a negative thing because in healthcare we kind of freak out about when the state board of health comes to observe us and make sure that we're still providing quality care. It's kind of a stressful time, but that's another way that we're ensuring that um, healthcare services are up to the standard that they should be. When I'm looking at these public health goals, um, I can't help but think about athletic training. And you guys know how I love athletic training, but every single one of these, um, I do every single day in athletic training. Okay, maybe not the epidemic. I suppose I work to prevent maybe a ringworm epidemic in the wrestling room or something like that. But every single one of these completely encompasses athletic training. When I think about the different roles of athletic trainers, we are very much in the public and we're very much under the public eye with everything we're doing. And I've never thought about us as being a public health worker, but we very much are. When we look at these basic health goals, they're exactly what we do. Maybe not in the community as a whole, but in the school as a community, we're definitely responsible for all of those. Okay, we're going to stop there for today. Hopefully, I gave you some good things to think about. I want you to kind of look through this, be thinking about different goals and how different agencies are working towards some of these goals and how they're achieved and how it is affecting things that are going on right now. If you are lucky enough to have someone in your household or someone that you talk to regularly that's working in healthcare, ask them. Ask them what they think about what's going on with public health right now. Pick their brains so we can chat about it either through a Google Meet, hopefully this week, or on our discussion boards. But I'd love to hear what other people's opinions are about what's going on in public health today, both people just in the community and also people that are working in healthcare. So that's kind of your little side assignment for today. Um, but that's it for tonight, and we'll talk soon. Well, I'm recording while I'm recording.